It's late afternoon. Thank you for your patience. I'm delighted to see the audience still awake. And thank you, Martin, and thank you, Larissa, who first contacted me and inviting me to this meeting, where I learn a lot, so from the conversations before. I would like to thank my colleagues at UNESCO. You know, this is like, I have 3 copies printed. If you're interested, I can deliver it to you after the meeting. And everything is available on QR code on the websites I'm gonna present using my slides. So I come from Turkey. Geopolitics, disasters, whatever you name it, everything is it's a multi-hazard country. I'm a statistician by training, so I'm a graduate of METU, Middle East Technical University Statistics Department. Then I pursued, and once I graduated and appointed as a teaching assistant, the next day, the August 1999 Marmara earthquake happened. So since then, I'm working with catastrophe data, earthquake data, and recently in the past few years, working with humanitarian perspective and governance of data in case of disasters. So UNESCO has Open Science Recommendation 2021. My colleague, so this is a joint work of Anna Persic from the UNESCO. She's the senior research officer who came up, who prepared the Open Science Recommendation of UNESCO, Simon Hudson from CODATA, Virginia Murray from UK HSA, Health and Security Agency, Francis Crowley, and myself. And with a larger working group, we prepared the data policies for times of crisis facilitated by Open Science Toolkit. I'm going to introduce it during the meeting, but the idea was merged with following the impact of the February 2023 earthquakes we happened in Turkey. We thought 1999 Marmara earthquake was a milestone, and then there's always the reverse. So everything changed, life changed, science changed, statistics changed, data changed. And this is data for me as a statistician. This is a visual data. This is the map. This is the color red is the location in the southeast of Turkey, east and southeast, where the earthquake occurred. So I live in Ankara, which is like above the White Lake in the middle. And this is central, where earthquakes safe, but you never know because you can travel anywhere in the world. So we need to be aware as global citizens where we're going to and understanding the risks. So myself, including myself, as a report for policymakers, because I work very close with the government officials. I'm not just in academia, but have a very strong collaboration or communication with the policymakers. I personally wrote several letters and reports saying that there's an active fault line in this area, which is the East Anatolian Fault. So expect an earthquake, prepare accordingly. I work with Disaster Emergency Management Authority of the country, AFAD. It's named AFAD, so everything is there. Scientific background is there, but the problem was implementation. As always, talking from my country, implementation of the building codes and getting prepared at the most appropriate time was the issue. So on the 6th of February, 2023, this is a centennial earthquake by the geologists because one earthquake happened, the first came in the morning, and 9 hours later another one happened, so which was really an extreme case. And this is the earthquake hazard map of Turkey that we use for the scientific background, if I may share. You see how the seismic regulations or activity is mapped with the green dots, and the one in the bottom is the yellow one, which shows the East Anatolian Fault line, where the earthquake, the fault ruptured and things happened. We knew about it because there was a historical data. So this is from a national newspaper. So Antioch is the region, and data going back, there is a series of earthquakes in the region. Okay, long list. So data was there. The problem was to use this data, respond to it, and prepare accordingly. So it's a centennial earthquake, as I mentioned, with 2 earthquakes at the same time at the same location on the same day. It hit 11 provinces directly and 81 provinces across the country. It's a multi-hazard event with cascading secondary hazards like flood, fire, and epidemics followed, and multiple sectors were devastated. So we need data to prepare for earthquakes before, during, and after as open as possible, but as close as necessary because people talk about national security. Disaster data is very sensitive in some cases. Drones can figure out the damage level. Missing people, still an issue. There are still missing people reported after the earthquake. Stakeholders need to agree, okay, national government, local government, municipalities, private sector, NGO, academia. So they need to agree and have a consensus. Data everywhere. Okay, there was data coming from different resources, from even individuals, volunteers, NGOs, frontliners, first responders, from the official data, unofficial data. So that was a mess. So as in the perspective of open science, we needed accurate data, trustable data, lack of data from the Syrian side because the earthquake affected the Syrian over the border, Syrian soil. So there was lack of data that which I didn't receive. I just read from different reports. We needed useful and relevant data, real time. So that's why we named it during the crisis, because when it's really there, it's very hard to get the real-time data. You can now collect it for the past, but like real-time data is an issue. Qualitative, quantitative, discrete, continuous, social, economic, environmental, physical, so there are so many variables of interest. And data data is stored at different locations, institutions like AFAD, in Bosphorus University, at Kandilli Observatory Center, if you are interested in earthquakes. And some data has some reserves, so we back up the data in different repositories. For example, TCIP stands for Turkish Catastrophe Insurance Pool, and it has a backup system in Ankara, not to lose any data. Now there are technologies, cloud, etc. We try to use it at the maximum level. Apologies for disturbing photos, but these are the data for the secondary hazards. We had the largest number of amputations afterwards. So that is a medical data. We had epidemics because of the hygiene and clean water conditions. We had flash floods afterwards. So the people living in the tents were in trouble, as you can see from the photos, and fires, because whenever there's an earthquake, they use electric heaters, which collapses and causes fire as a secondary hazard. So everything needs to be planned with scientific background and as open as necessary to keep people, the community safe and life ongoing. This is Antakya, 2023 drone images just after the earthquake. And this is last year taken by me, myself, and my colleagues. So it's like an open construction site, thousands of cranes, huge construction, mass construction going on in the area. And there are lots of thousands of buildings rebuilt, and they are supposed to be handed, the keys needs to be delivered by the end of this year. We'll see in terms of the political perspective. This is what a typical container city looks like. So people live there. Okay, they used to own their buildings, houses, flats, but they lost everything, so that's the social part of it. So whatever they're building in the current conditions is like they're trying to build safe sites, like maybe the durability of a building, earthquake safe, like 100 years, say the lifetime of a building. I don't know what happens after 5 years. This is a typical village construction they built, and one state hospital collapsed during the earthquake with ICU beds, and babies were killed in the intensive care, so they rebuilt the hospital because you can keep everything delayed, but hospitals need to operate 0 time. So medical data, hospital safety is very, very crucial. And that takes us to the data policies for times of crisis facilitated by Open Science project that I mentioned you. So the link is there, you can get connected. Excuse me. We are in favor of open science. I'm a scientist, so I need to reach data, I need to understand data, it needs to be equity is an issue, inclusiveness, accessibility. We need to all provide these to researchers so that knowledge grows as time goes by. This is the timeline we use. So we launched it in June 2025 in Paris at UNESCO Promises, but the idea dates back to March 2023. So that is our timeline, what we followed. So we had a fact sheet, guidance, and checklist. So the fact sheet covers everything comprehensively, what you need to do before, during, and after crisis to receive data, analyze data, understand data, and use it in policy. Guidance is for policymakers mainly. So what they need to do, and checklist is to put a tick at the end of the day if everything is in order. So you can get connected to the documents and see, like, we really want to have the data ethics. We really want to develop data governance. We really want to facilitate open data collection. We really want to have open data infrastructure, strengthen public engagement and communication, and more. So readable, downloadable format with the QR codes. And from guidance to action, we need to adapt with the digital age as well as all stakeholders in every capacity. And that's a picture to show the solidarity of the people that they didn't know each other before. Okay, and thank you, and my email contacts. I think I'm on time, yes?
We still have quite some time. But yeah, that gives us some more time to ask you a question about this very interesting project that you have been given. Are there any questions here from the room?
Silence is golden. That means everything perfectly well. I see the heads nodding. No questions? Comments? Okay. Okay, you can catch me during the meetings, during the break if you like.
Okay, there was something.
Yeah, if I may, I have a tiny question about the sort of data, the types of data we are talking about. It was fascinating how you outlined how important it is and that it is important to have it quickly. But I guess the data that is necessary goes way beyond scientific data, strictly speaking. So it's
yes.
all sorts of, I don't know.
Any type of, so during a crisis time, any type of data arrives. They tell you the location of the collapsed building, they tell you how much medication is needed, they give you the age of the building, like at the real time, everything flows like without any order, it's chaotic.
But making these, like, what's the platform to figure that out, to get as much data of all sorts of types beyond.
Good question.
Type.
So AFAD, the National Disaster Emergency and Management Authority, is the main responsible body to deliver data. So they have everything in their system in connection with line ministries, NGOs, local governments. So if you want to reach out to that data, you need to go and consult with them. But that brings to the closeness part of the data, because sometimes some data you can reach as a researcher, sometimes some data you cannot. They say it's confidential, national security, blah, blah. But we need the data to make policies for future safety of the communities, if that answers your question. Thank you.
I might have a question of my own. I was wondering, you mentioned that this is mainly addressing also policymakers, so largely governments. Yeah. So after the launch, that was only this year, so it's probably hard to tell. Yeah. But what was the reception from governments?
Thank you. I'm running a workshop at METRI on 27th, 28th of November, where the stakeholders will gather. And we're gonna share this with them, as well as some other co-data products like interoperability, fair data systems, so HIPS, hazard information profiles by UNDRR, second version is out, so we're gonna introduce them to the stakeholders and use Turkey as a pilot case and see. I can answer it afterwards via email.
Great, yeah.
Yeah, here's a question from the online audience.
Okay.
Did, for example, insurers agree to some sort of open sharing of data?
Okay. I am the first researcher who used the TCIP, Turkish Catastrophe Insurance Pool data, for my PhD. So that pool was newly set up that time. So I asked for special permission from that time from the National Reinsurance Company to use the data belonging 2000-2003. So if you do it for academic purposes, and if there's a trust, okay, they provide you the data. And this year, in 2018, I asked for updated data for one of my researchers to study with. They blocked some data. They gave me the unconfidential part, which they could share because of the data protection regulations of the individuals who were paid for. And this year, I asked again, so they're going to block censor some confidential data for the sake of the insurance policy holders. So I don't need their names or their education or whatsoever. They provide the the data that I can use for research purposes, which was fine for me. Yeah.
Okay. Thank you very much.
You're welcome.
I hope everyone has time to look at these very valuable materials, and I know that you're still sticking around.
That became kind of a case study of wrapping up all the sessions from morning onwards, how the data goes in real life, in action, via open science.
You really see the practicability of it. Thank you. Okay, thank you.